Perineum, peritoneum. Man, do they sound alike. But here's the thing, one is on the outside of your body and the other is way deep inside. And confusing them? It's not just a simple slip-up. In a medical setting, it can actually be a pretty dangerous mistake. So let's clear this up.
Okay, so which one's which? And hey, if you've ever had to stop and think about it, you are definitely not alone. It's a super common point of confusion. But as you're about to see, getting it right is so important.
Here it is, the absolute core of it all. If you remember just one thing, make it this. One of these is external, on the outside. The other is internal, deep on the inside. And mixing them up? Yeah, it's not just a minor slip of the tongue. In a medical context, that can be a seriously dangerous mistake.
All right, let's tackle the first one, the perineum. To really get this, think of it as the foundation, or maybe the floor of your entire torso. It's what we're talking about when we say pelvic floor.
Now the official definition, whoa, it sounds super technical, right? Located between the pubic symphysis and the coccyx. Let's just cut through the jargon. The pubic symphysis, that's just the front of your pelvic bone. And the coccyx, that's your tailbone. So when you put it all together, we're really just talking about that external area of skin and muscle between the genitals and the anus.
So what's its job? Well, it's a big one. Its main function is supporting all those powerful pelvic floor muscles. And that, in turn, helps with, maintaining both urinary and fecal continence. But where you hear about it most, oh, for sure, it's during childbirth. This is the exact area that can sometimes tear or might need a surgical cut, called an episiotomy during delivery.
Okay, so we've covered the outside. Now let's take a trip deep inside the body to meet its sound-alike twin. Section 2, the peritoneum. This is all about the abdominal lining.
Right off the bat, unlike the perineum, you can't see or touch the peritoneum. It's this huge, thin, continuous sheet of tissue. The best way to picture it, it's kind of like a big sheet of biological saran wrap. It lines your entire abdominal cavity, and then it folds over to cover most of your organs. We're talking your stomach, your liver, your intestines, the whole shebang.
So, what's the peritoneum up to? Well, it's multitasking. It acts as a pathway holding all the crucial blood vessels and nerves that your organs need. And second, it produces this special lubricating fluid so all your organs can slide past each other smoothly. But medically, this is where things can get really serious. It's the site of peritonitis, and trust me, this is a life-threatening inflammation of that lining, and it's often caused by something scary like a ruptured appendix.
All right, we've met them both individually. Now for the main event. Let's put them side by side to make this distinction absolutely crystal clear. This is where it's all going to click.
So let's just lay it all out. The perineum, that's all about the external world. It's on the outside, in your pelvic area, and its whole deal is supporting that pelvic floor, especially when we talk about childbirth. Now the peritoneum, it's the total opposite. It lives inside your body, way up in your abdominal cavity. Its job is to line and protect your organs, and its biggest problem is internal infection. One's about support at the base of your body, the other is about protection at the core of your body.
Okay, so you might be thinking, this is interesting anatomy, but why does this really matter? Well, in the real world, in actual medical situations, confusing these two is a really big deal.
I want you to picture a delivery room, right? The doctors, the nurses, their focus is 100% on the mother's perineum. They are managing how it stretches, they're watching for any tears. It's all about that external structure. Now let's completely switch gears. We're in the ER, someone comes in and they think their appendix just burst. The doctor's minds are racing, but they are not thinking about the perineum. Not at all. Their number one fear is that bacteria is going to leak out and infect the peritoneum, causing that potentially deadly peritonitis. And that's really the bottom line here. This isn't just about acing a biology test. Knowing the difference between these two, it actually empowers you. It gives you real clarity and real confidence, whether you're talking to your doctor or just trying to understand what's going on with your own body.
So just remember, perineum is the foundation on the outside. Peritoneum is the lining on the inside. A super simple distinction, but one that makes a world of difference. And it gets you thinking, what other medical terms sound alike but are totally different? Let us know what we should break down next.